Hey guys, Don here. Welcome to the $1 Million Minute, where we're trying to help you get your practice to the $1 million mark and beyond. And it is snowing for the first day here in Massachusetts. Kids got their snow gear on, so it was kind of hectic. The kids were hoping for a late school day. I was kind of hoping for a late work day, but nothing worked out today. So let me go through kind of the day. What's kind of been in my mind lately is the Shockwave conference that I'm going to this weekend in Boston. And I was talking to a friend of mine, Larry, and he was asking about using Shockwave for tarsal tunnel. I want to be clear, I have not done that many times. I do it quite a bit. I've had some good success with other things, but not much with nerve issues or neuropathy. I've tried it in the past. Some people swear by it. I haven't had the greatest success. So let's go here. Talk about the day. First of all, I always like when I write things down, this is something you might want to consider doing, is trying to figure out what your MVP, your most valuable patient of the day is. So mine was a patient. She's a 37-year-old female that came back after the first plantar fasciitis visit, and she needed a bilateral ultrasound. So I got one on the plantar heel on the right, and I got one on the posterior heel on the left. So she had plantar fasciitis on the right and Achilles insertional tendinitis on the left. And what really helped her to see that was doing right and left feet, right? And so when I did that, she's like, oh yeah, I can see the thickness. I can see I need the treatment. And so what she's going to do is she's going to do bilateral Shockwave. So plantar fascia on the right, Achilles on the left, 3 sessions. And so that would be the MVP. And so she would do 3 sessions bilaterally. Okay, that was for the day. And we also talked about orthotics kind of further down the road, kind of planting that for the future. Okay, the other things that I saw, there was a Shockwave patient, and I'm kind of writing down the area that I treat just to help you out a little bit, to maybe think outside the box if you're doing Shockwave. This patient had second metatarsalgia, and he was feeling better. Second had metatarsalgia, and so we have one more for him. There was a Lamisil booster, so that would be, that's the second Lamisil appointment. I've kind of talked about that before. There's a patient that came in with an ankle sprain that we did meloxicam for, and also fungal nail. So I took the nail sample, ankle sprain, and for this patient, we're going to do a nail sample follow-up in 3 weeks. And I've been thinking lately about not doing my 3-week nail sample follow-up. What I've been thinking about doing is only having the positive ones follow up. Once again, I'm always trying to reduce the low-level visits. And sometimes I get them back, and I go over the nail sample, and it's like not fungus. And then what do you do then? Like, your nail's ingrown, and it's a little bit thickened because of that. Can't really do much with that. Another patient that came back, this is a patient I see once a year. He's a pharmacist. Got an x-ray. He has really bad arthritis, and I just see him kind of like once a year. So it's nice to chat, but that's not really a most valuable patient. There was EPAT number 3. This is a patient that she was post her amnio injection. She's a 55-year-old female. She had second metatarsalgia for over 5 years, seen 2 or 3 other doctors. And she was wondering, well, why didn't anyone else offer me this amnio or the Shockwave? I'm like, I don't know. But she did much better, much less swelling after this amniotic injection. Everyone asked me, what do you use? I use the Right Medical. I think there might be a problem in getting a smaller cc amount. I use a half cc. When I do that, and I reconstitute it 3-to-1 with some just regular saline, sterile saline, and I use like a half cc of Marcaine as well. That was, so she's EPAT number 3. Now, because she's had pain for like 5 years, and she's really paranoid, and so am I, I'm going to do 6 total Shockwaves. And I'm going to go to this conference and see. I know a lot of people are recommending 6 straight away, but I usually do 3. That's what I do. I know that other people do 4. Other was a new patient. This patient had a possible nail fungus, and they had a lifted lytic nail that was painful, and they somehow jammed it maybe, but the nail was painful when I lifted it from the distal tip, and it kind of hurt all around. But she really didn't want a nail avulsion. So what I did is I put her into a carbon fiber shoe insert, like one of these carbon fiber inlays, so it's not going to bend the toe. So hopefully if the toe bends less, it's going to hurt less, and the nail will just grow out. So we'll see how that works. If not, I told her she's going to have her nail come off. Another patient that was here, he's a 68-year-old man. He had a fracture, 5th met, that's feeling better, but now he has heel pain. And I'm not sure if the heel pain happened because he was walking different, or I think he may have even had it before he got the fracture, but I treated the fracture. He's past the the 90-day global window for the fracture. And now we're going to start treating for the plantar fasciitis. So we're going to set up 3 sessions of Shockwave. He wanted the first one yesterday, so I did that. Another patient for left plantar fasciitis, Shockwave. This is EPAT number 3. So always with the last EPATs, whatever that might be, 3 or 6 or whatever, I go through my little last Shockwave sheet. If you want that, just send me an email, don@podiatrypracticemastery.com. I'll send that to you. But that's how I get a level 3 office visit after every last Shockwave. The next patient was a possible melanoma. They were concerned about a melanoma on their nail. I think we've all had these, but really it was just dried blood. I tried to cure it, it didn't work, so I ground it down a little bit. I do not use a grinder that much. I do not do that, but I do have one in case I want to do like the Carry Flex or the Ani Fix once in a while. Another patient that came in, Lamisil. These are kind of challenging. She had kind of thickened nails, and put her on the Lamisil. She was on the biotin, and I really didn't see much proximal nail clearing. So with these ones, I tend to switch them to something else. So I switched her to I usually either do diclofan, or itraconazole. So, but I switched her to diflucan for 6 months, once a week, and so we'll see if that one works. And if not, it may just be from her nails, because she's got these kind of distal hammer toes that are hitting the shoe, and she's a carpenter, and her nails are kind of curved, and I find those ones tend to be thick. They look fungus, but they might not be fungus. Another patient that came in for bilateral hammer toes, we got her some crest pads, no follow-up for that. Another patient that came in with 5th MPJ pain, we did an ultrasound. He was feeling slightly better, so if he gets better, that's fine. If not, I recommended Shockwave because I had such good success on this other 5th MPJ. Another patient that came in, I got an x-ray for her and an ultrasound. She's a 78-year-old female with pain to the second met pain, and it's just been painful for a long time, and she's really not getting better. So I put her in a cam boot, and then I recommended, if it's not getting better, to do an MRI for her. But she's a 78-year-old female. She's just really not getting better. She doesn't really have stress fractures, and I don't think she would be a good candidate for Shockwave. So I wanted to or she might be, but I wanted to see what the MRI shows. So she has not got an MRI, so that might be the next step for her. Another patient came in for a total nail avulsion. She had a very loose nail. She almost did it herself. Another patient today, 80-year-old patient, had an exostosis, kind of that kissing corn between the 4th and 5th toes. I trimmed the callus. He's had that callus trimmed a couple times. So I talked to him about doing an exostectomy in the office, and that would be at a different time where you just kind of shave it down. Another patient came in for an IND because of the cellulitis. So because of this is really bad cellulitis, so I put the patient on an antibiotic. I don't normally do most for my INDs, antibiotics, not for everyone. This was like an 80-year-old female that had this. And then also another patient that came in for ingrown toenail. I took a nail sample, and for this one, I'm not going to have them back. I'm only going to call them to come back if the nail is fungus, so then I can do my fungal nail treatment process. Okay. Another patient was EPAT number 1 for sesamoid and 1st MPJ pain. I don't do a lot. I'm starting to do more because I had good success on the 5th MPJ, so now I'm doing the 1st MPJ, I'm doing the 2nd MPJ. So these types of things, maybe where you don't want to do a cortisone injection and you don't want to boot the people, I think a Shockwave would be a good option. Another patient that came in, 16-year-old little boy, just for bilateral matrices. And then just a lot of ingrowns at the end of the day here. Another one at bilateral INDs. Another patient that came in with warts, so we did laser and cantharidin. And my last patient of the day was this MVP patient, this bilateral Shockwave. Anyway, that's the day. Hope you guys find this beneficial. I talked to someone, sent me a message the other day, said, Don, it sounds like you're whispering. If you feel like I'm whispering, let me know. I'll try to get a better mic. But if you can hear this, let me know as well. I just want to know so I can make these good. And people have said that they've kind of enjoyed seeing how I go through my day. And the purpose of going through this isn't to tell you what I'm doing. It's to show, like, this is how I get to the $1 million mark. And as you can see here, there's not much fluff in terms of patients. I used to have a lot more fluff, and what I considered fluff was like these breaks between where I would have them come back for like a paronychia follow-up or a matrix follow-up or other types of follow-up. So I try to cut all those out so I can kind of keep the focus on being what's most productive. Now, I'm at a different phase than maybe some people just starting out. Like if you were just starting out, like every matrix would come back twice, right? At 2 weeks and at 4 weeks. Like you're trying to build up your practice. But right now, with more of a kind of an established busy practice, I try not to have them come back as much. I still give them care. I give them access to me. There's a way on our website they can text a picture to me. They can do it through the portal. Like I'm super available, but I try to save them their visits, and it also helps me to produce more because I can just see those that are more valuable. Okay, thanks guys.